I had cancer in my thyroid, and they did like a body scan where they scanned it from here down to your waist. Well, they noticed I had a nodule in my lung.
With lung nodules, usually they are in the outskirts of the lungs. Traditionally, we used to have our radiologist take a needle and do a biopsy through the chest. And our lungs being balloons, there's always a chance that they can deflate and have complications. And so with this new technology that we have, robotic navigation bronchoscopy, we are able to do it while the patient is asleep, and we are able to use a GPS system, go to the nodule, and take biopsies and get an answer right then. And it has a much lower complication rate. As you can see, as I advance my real scope, my GPS also moves with me. When they go to sleep, they have a tube in their mouth, in their lungs to help them breathe, and we take the scope and put it right through there. And that's how we take the biopsy. Usually we have our pathologist in the room when we do the procedure. So as we are getting samples, they make slides and take a look under the microscope right away. And it articulates 360 degrees. Within one procedure, we know exactly what it is and how far it has spread.
Kalani just said that he was gonna be doing the procedure. They're gonna put me to sleep. He was then gonna put this, it's like a long cord with a camera on it, which I got one that works just like it. I use it for work. But, you know, they're gonna go down in my throat, you know, into my lung, and they're gonna, you know, that way they can see it. And then he's got this whatever kind of tube that goes down in there, and then they can get the pieces of it.
Dr. Kalani does the biopsy, and if it becomes cancerous, then patients will come to us. That's where we get involved in planning the treatment. Me being a medical oncologist, most of the times patient comes to me, and then we send the patients to the right people, like let it be a surgeon or radiation oncologist, we channel them. There are two goals in this program. One is to find the cancer, catch it early at early stage. That's the most important thing. The best way to cure any cancer, lung cancer included, is to find it at an early stage and cure it. That's the best way to do it. The second thing is decrease the lag time between diagnosis and treatment.
I got stage 2 cancer. They're gonna do chemotherapy first, and then after the chemo is over with, by then they'll know, you know, what procedure they can go in and take it out.
We have a fantastic team, from our oncologist to our radiologist to our surgeons, and all of the staff that are supporting them. We are able to catch cancer early and hopefully provide them with a cure.